Now we come towards your muscles of the pectoral region. First main muscle is the pectoralis major muscle. So this muscle, your pectoralis major, it is having its origin from two areas. First of all, it is having its origin from the medial two-thirds of the clavicle, then from the anterior border of the sternum, from the upper region towards the sixth costal cartilage. Then it is having aponeurosis with the external oblique muscles of the abdomen. So clavicle, T2 to T6 region of your sternum, external oblique aponeurosis. This was the origin. Insertion is going to be on the lateral lip of the intertuberculous sulcus of the humerus. Lateral lip. Okay. Main thing is this. Now what will it do? Remember, always remember that the origin will pull the insertion towards it. Right? So what will happen? This region will be pulled towards this region. This region will be pulled. So what will happen? Medial rotation and adduction. So look at this very nice animation. What is happening over here? This is the pect major muscle and it is being adducted. The humerus is being adducted. And this is the internal rotation or medial rotation of the humerus. Majorly by pectoralis major. Since the pectoralis major is also attached to clavicle, so it allows for the flexion of the humerus. Very nice flexion of the humerus. So this diagram explains for the nerve supply. It is mainly by the lateral cord of the brachial plexus, the lateral pectoral nerve and the medial pectoral nerve. It supplies your pectoralis major muscle, which has a movement of flexion, adduction and internal or medial rotation. Second muscle over here is the pectoralis minor muscle, having its origin from the third, fourth and fifth rib outer regions. Insertion is on the upper and superior surface of the coracoid process of your scapula. Since the pectoralis minor was having its origin from third, fourth and fifth ribs, so the nerve supply would be medial pectoral nerve. Also remember, since the pectoralis minor is attached to the scapula, so main function is stabilization of the scapula, nothing else. So now we come towards this muscle, the subclavius muscle. It is attached at the junction of the first rib with its costal cartilage. Origin is this first rib and its costal cartilage. Insertion is on the middle portion or the inferior side of the junction, or you can say the inferior side of the middle third of the clavicle. Inferior side of middle two third of clavicle, and origin is from first rib along its costal cartilage. Okay, so the main function of the subclavius muscle is to depress the clavicle or move it downwards, and the nerve supply of this will be nerve to the subclavius. So now we come towards this muscle, that is the serratus anterior. It will have its origin from the upper 8 or 9 ribs. See, it is saw-toothed muscle and it is having insertion on the medial border of your scapula. So this was the medial border. It's having its insertion and origin is from upper 8 to 9 ribs. Always remember, the origin will pull the insertion towards it or the movement will be in this direction. And now the serratus anterior muscle is supplied by your long thoracic nerve. Long thoracic, and it is having three main words: C5, C6 and C7. Always remember C5, 6 and 7 for the long thoracic nerve. So now the serratus anterior will bring the scapula forward. Also, it helps to do the pushing action. Bring the scapula forward. Bring the scapula forward by the serratus anterior and the pushing action by the serratus anterior. The pushing action. Also remember, serratus anterior or the sawtooth muscle is your boxer's muscle or swimmer's muscle, mainly because it does the pushing action.